Are you a physical therapist and you are interested in learning how to better prepare for an interview with either a pro team, your dream job, a high caliber performance center, a university, whatever it may be? If you are looking for strategies on what should I do, how should I prepare, what do I need to be aware of, and what will happen in this series of interviews from the first interview to the final offer. What's that process and what do you need to look out for? If that's what you're interested in, you need to tune into this video. Before I go on to the video and talk about all these tips about interviews, you really have to understand what the framework is, what's the employer doing, what is it they want from you as a skilled clinician to be able to deliver at the highest caliber to athletes and be part of a greater mission, a vision to be able to help athletes and the team members inside that staff. And so as you navigate preparing for this interview, you need to consider multiple things before you go talking about yourself. That's our instinct to talk about yourself, tell why you're the most qualified and why you're going to be the game changer in this missing piece inside this organization. Before you do that, there's a lot to consider. My name is Dr. Chris Garcia. I'm a sports physical therapist, residency trained. I've worked in pro sports for over 10 years, and I built a cash-based multi-location facility out in San Diego, California. And after navigating multiple interviews, interviewing hundreds of candidates myself, there's a lot of things that I've learned inside pro sports, inside working with high-profile teams, both traveling nationally and internationally, dealing with clients and patients and athletes of all different types of sports. I wanted to share my key components and takeaways from both interviews that I've delivered and then interviews that I've been part of as a staff employee, as a team member. So I've been able to see both parts, both sides of the organizations. And I'm here to make your life a little easier to take the second guessing out of the equation and ultimately give you the confidence that knowing when you go into an interview, you never know what to expect. But if you can be as prepared as high as possible, it puts you in a better position to feel confident, to know you have the comfort that you're going in with all the tools that you possibly can have and, dealing with the unknown as best as possible. So anytime that you have you're applying for a position, there's three big needs across an organization. What you're going to do for the organization, what you're going to do for the patient or the athlete, and then how you're going to work together amongst both of those individuals. And as you understand this, you really have to think about, okay, well, how do I play a role? What you typically will consider as a staff PT and really excited is it's me. You think it's all about you, and this is the challenge I've seen inside pro sports. What it really comes down to is what are we doing? And so instead of me, it's about we. So how do you fit inside this organization? And what you have to understand from a top-down perspective is, what is the organization's mission and vision? You have to align with that. If it's to win a Super Bowl every single year, that's probably not their mission. Their mission is probably to deliver on the highest standards, highest performance of any organization, and win championships at the same time, because the standards and values that they have as a team represent the framework, the foundation of what they do day in, day out. And that is what keeps them at the highest level so that they can deliver, on the pitch, on the football field, on the basketball court at the highest level. So you have to understand, what is their mission? What is their vision? And that's probably something you can find on our website. Maybe you've worked with somebody inside of the organization. It's the second interview. And now it's your job to go further and to explore this. And what you'll find is you find that mission and vision, and if you can, find their core values. What is the values of the organization? What is it that they care about? And I'll share 5 common ones that I see inside organizations that's very important and critical for you to consider as you go on. Is this really you? Is this the position that you want? Because what you'll probably fall in love with is performing the tactical, the technical components. But what you have to realize is those technical components are a bigger part of this system, and you have to align with the system. And if you don't understand that, you'll have a hard time delivering on the service. So when you're looking at their mission, their vision, and their core values, some of the things that they're looking for is, are you an A player? Do you have this this incessant passion? This like, do you dream and sleep, and what is it that you do for physical therapy, or whatever your healthcare profession is? Do you dream about it? You're obsessive about it, and that's what they're looking for. They're looking for somebody who has the highest passion, not just the technician, because in theory, the best physical therapist or the best mobilization or taping job can be done by anybody. When you get to a certain level, yes, you may have 3 to 5 year, 10 years of experience. You might think you were the absolute best at doing that. But if you don't align with the company and what they do and how they run their system, you won't last. And they've realized that over time, especially if you're working with a high profile team. So you have to understand that they're looking for that person who is, is a go-getter. They're eager to learn, and they haven't stopped. That's probably, you might be like, I check that box. That's not a problem. The next piece is, do you have the initiative? Do you take the time to really self-develop? If I looked at your list of podcasts that you've listened to, how many have been played over the last few weeks or months? How many books have you read? What courses have you taken? All to show, what is it have you done? Show me, don't tell me. You might say, well, I've been doing all these things, and yeah, that's great. Show me. What does that look like inside your phone? Let me see how organized you are as a clinician. I need to see that action in your daily life, not just what you tell me. So as long as you have that great attitude, you have that great initiative, you've shown that. Now they want to know, how good of a team player are you going to be? As you navigate, well, I am a team player. I've worked for 3 different companies. I've done such and such. Are you going to fit and support the team there with the system that they run? Now you might say, I'm a team player, but I don't fall in line with the system that you run. I don't believe in this. I don't like these things. That's something to discuss at the interview, and say and ask and figure out those things and see if you align with them, because you're not going to change an organization. And that's what I see a lot of healthcare providers, physical therapists do. They want to be a bull in a china shop. It's worked well here. I'm just going to come and do it here. I know your organization runs it this way, but this has done really well. And that's when you get fired. That's when you don't align with that. So it's best to figure that out right from the beginning. So ultimately, they want to figure out, do you have the right attitude? Are you positive? Are you adaptable? Are you flexible? If things go wrong, do you really stress out? It's hard for you. Do you second guess yourself? Those are all qualities that an organization at the highest level might not want. And if you second guess yourself and you have a hard time making decisions fast, that will show on the field when you need to make a decision, when an athlete needs to return to sport. Are you eager to learn? Meaning it's Friday night and you just finished a game and you have an injury that's unknown to you, and they play tomorrow or Sunday or the next day. How fast are you willing to do it, even when you're tired and you're exhausted and you don't think you have to, but you should? Are you going to do that? And the last one, as I mentioned, are you going to be a team player that aligns with their system, that when things go wrong, you have to trust the process? And if that's you, and if you're saying, hey, well, I do question myself, I do learn here and there, but I'm not as consistent as I want. This organization, you'll be eaten alive. You'll get into a place where you got into it for the wrong reasons. You wanted it for the notoriety. You wanted it for the resume builder. And these people are, they're not new to this concept. They know that. And that's why they're trying to filter this out. So if you've shown that you have the right attitude, you have shown that initiative, you're such a great team player, that's fantastic. That'll get you in the door. The 2 different parts, the 2 different next pieces are going to be critical to your growth and the growth of the organization and their athletes. And that is your standards. Your standards have to align with the standards that they need as they grow. And you might say, well, this is my 8th year out of practicing, and I've been doing this for a long time, and my standards are high. That's great. But as your life changes, you have a new partner, you buy a new house, you get a new dog, you have kids. Do those standards, as you've grown your family, do you still continue to raise your standards? And that is tricky for an organization. They want to be able to see, Can you grow with us? Can you do this at the highest standards and follow with us as your life changes and adapts? And that's an interesting question, because a lot of people don't think about this. Like, I just want a job. That's fantastic. And if they're looking for somebody for 2 to 3, 4, 5 years, that's fantastic for what you know now. The question is, can your standards continue to rise at the level that an organization needs to? And that's a self-reflecting question. Do you truly believe that? Do you feel that you can keep this at a high level despite the changes in your lifestyle? That's a big question for yourself. And as their standards change, they win a Super Bowl, they win an NBA championship, they win a MLS Cup, and now their standards raise. And like, we want to do it again, but now we have to practice 2-a-days. We want to be able to have 27 games, and whatever that is. Can you rise to those standards? It was fun while they weren't MLS champions, but now can you rise to the next level? That's a different scenario. And then habits. The habits, once you've shown I've got the right attitude, a good initiative, I'm a team player, I've got the highest standards, that's great. Can your new habits align with all those new standards? Are you able to get up early, skip your lunch, work late at night, and do that repeatedly on an occasional Saturday and Sunday? Or if an athlete needs it, do 7 days a week for 3 weeks straight. Do your habits align with that? You might say that, but you're like, I'm not organized. I have 1,200 emails, 37,000 photos. I haven't been able to get through these things, and it's all because your habits haven't improved over time, and they're not magically going to do that all because you get a job in pro sports. Ultimately, they're looking for the person who's already demonstrated that, not the person who's eager to start that process. And the last piece is, can you perform and deliver the results that you say you can and that the organization needs? And we're not talking about simple manual therapy or corrective exercise. They're looking for somebody not just who has shown in an orthopedic outpatient setting that now can deliver it to an athlete who they have to maintain and they have to support, sometimes 24 hours a day, 7 days a week. And that's a very different setting. If you're coming from an outpatient setting and you've only seen people traditionally 3 or 4 weeks after injury, and you only see them until discharge, it's very difficult to understand the context of pro sports, because context of pro sports is it's on and you are on all the time, and you're working with acute injuries. You're working on strength and conditioning with strength and conditioning coaches, not just your simple home exercise that you upgraded with a few reps, sets, and weight, but a pre-programmed template that helps somebody across a year. Can you perform that result at the highest level under pressure with everyone staring at you, and deliver at the highest standards despite there's things going on in your life? That's the caliber of a physical therapist or healthcare provider that they're looking for. Somebody who's resilient, passionate, nothing stands in their way, and they're going to grow. They're going to find the solution no matter what. Is that you? That's the question you have to ask yourself. And if you still think that that's you, all they're going to do in their interview processes is ask you questions. Why? When? Show me. How? Why did you think that way? How did you do that? You might be thinking, well, I have 10 years of experience. Why is this different? They should hire me because of my technical skills. Your technical skills are only a portion of the job. Ultimately, you're part of a system that breeds excellence. The question is, can you fit inside that system to help the organization breed excellence? And if you can't, that's not you. If you're looking to grow your own skills, your own resume, they'll feel that in the interview. It has to be about we. It has to be about them. But if you're saying that it's all about you, me, you're going to be in trouble and you won't get that job. After going through these interviews, I used to interview students for physical therapy school. I used to interview physical therapists for residencies. I used to interview candidates to be in pro sports as part of an organization. I used to interview volunteers with the United States Olympic Committee. And I would find high caliber clinicians who wanted to be part of the organizations, and all they would talk about is why they were good, themselves, their history, their outcomes. And that's only 1/6 of the puzzle, 1/5 of the puzzle. I could already tell that they weren't going to be part of the team. They just wanted to use it for themselves, to advance themselves. And as an organization, all we're trying to figure out is how do we work as a team to make sure that these athletes are safe and can perform at the highest level consistently. So when you start to look at an interview process, begin to ask them, how do you work as a team? How do you work in a system to deliver these highest results? How would I look inside that system? What challenges have other physical therapists had joining these type of organizations? What are the things that you didn't like about previous candidates or previous people who've worked in those positions? What you have to do is figure out what they really want and what they've gone through, what they didn't like about previous candidates. And once you understand that, and then that aligns with all the skills that you have, and you have all the qualities that I mentioned, and you can perform that at the highest level consistently, well, it's a no-brainer. It's a match. But most people don't see it that way. They're like, well, I did this. I did the residency. I did a fellowship. I volunteered here. I built my own practice. I work with pro athletes. That's great. But how does it work with us? Tell me how that helps. And that's where most physical therapists get stuck. Now, after watching this video, this gives you the confidence to be more prepared, because every organization is going to be different. The needs and small things will be tweaked here and there. But they're all looking for the same thing. The superstar, the rock star, to join their rock star team. That is ultimately what they're looking for. Do you have it? That's an answer and a question for yourself to be answered. And if you don't, how do you develop those qualities? That's a question to ask. Then if it's not right for you now, that's fantastic. But now you have a framework to work off of. Most physical therapists look at growing their technical skill. But that was only one of the 6 qualities that I talked about. Are you really working on the other things consistently? Or are you only putting in hours for CEUs and not developing yourself as part of a team player, as part of your own personal organization, to be more organized, to be able to do things at a higher level, manage things, manage stress at a higher level? Because in pro sports, that will be the lifestyle, especially as you travel. That's the challenge a lot of physical therapists had. They thought, well, in orthopedic setting, I'm off at 5. I start at 8, I'm off at 5. I only did my notes and I documented during these times, and that was the norm. In pro sports, that's not the case. You're going to be working 70 to 80 hours a week. There's no clock in, clock out. There's no lunch hour. You navigate and you work around the needs of the athletes in the organization. And that's probably the biggest challenge that a lot of physical therapists have who've not worked in pro sports. And if you're looking for a job that is, I'm here to coast, I'm here to make a lot of money with notoriety, this is definitely not for you. The mission and vision has to be aligned with who you are. You don't care what it takes. I just want to help these athletes. I just want to be part of something bigger. I want to help this organization win. I don't care what it takes. I will clean the bathroom. I will stay here after hours. I will do whatever it takes to help these athletes. That is the team player that they're looking for, and those are the core values that they're looking for. Now, do you align with that? That's the question you have to know. From there, as you work on these interview questions and you navigate these things, I can tell you one thing. Just be yourself. Enjoy the process. Speak to them as if you were having a fantastic conversation. Yes, you can be professional. Dress professional. Be ready to discuss. But tell them your story. Tell them who you are. Why do you feel so passionate? Can they feel that? If they can't feel that and you're monotonous and it's not being conveyed, you'll never get the position. They naturally, genuinely want to know who you are and why do you want to do this? And the thing you want to avoid saying, I just want to help people. I just want to help people. But why in this organization? You can do the same thing in a hospital or a clinic. Why us? Figure that out, and that puts you in a better position to allow people to understand why you truly are the best fit for the organization. So those are all my tips. After, as I mentioned, after working 10 years in pro sports, I worked for the United States Olympic Committee and managed their volunteer program. I worked as a physical therapist, interviewed candidates, were part of the hiring process. After that, I was a professor or adjunct lecturer at San Diego State University, developing their Doctor of Physical Therapy program. And I had a great opportunity to be able to interview candidates and look at resumes, and I understood what not a good fit was, because when you see 400 or 500 applications, you see the same thread of people saying the same generic thing, and you have to stand out for yourself. After that, I built my own cash-based practice, and grew to I think at the highest time 16 or 17 employees very quickly. And I learned that when you do this properly, and you understand the person behind that, and they understand what you want, it's a joint venture together. I want to go here, I need your support to get me there, versus I'm over here and I want to accomplish this, and you're over here saying you want to accomplish this. Those never align, and they never last. And so to put yourself in a better position, understand where the organization is, understand what they want and need, and then does that align with you? Then it's a no-brainer. But if you're over here trying to align to, it really doesn't matter, I just want a job in pro sports, that's a long journey. You'll be inefficient with your time, and you'll be wasting your time. So I hope that helps you inside your professional career and wherever you find yourself stuck. If you want to know any more information about how I can help with more interview tips or anything else, go ahead and click on any of the buttons or links below. But ultimately, I'm excited to see you inside the pro sports world, and I wish you nothing but the best.